Hello, everyone. Good afternoon. I'm Marianne Gomez Orta, President and CEO of the Congressional Hispanic Leadership Institute. Welcome to our CHLI Public Policy Briefing on Innovation or Access. Is it a singular choice for public health? Again, thank you so much for joining us today. A couple of things that I want to share with you before we get started with the program. So first of all, if you're not familiar with the Congressional Hispanic Leadership Institute, known as CHLI, we're the premier organization founded by members of Congress to advance the Hispanic community's economic progress with a focus on social responsibility and global competitiveness. The CHLI Public Policy Congressional Briefing Series facilitates in-depth dialogue with various perspectives to discuss relevant legislative topics impacting the U.S. Hispanic community. During our discussion, please feel free to tweet, like, comment, all that good stuff on social media. Use the hashtag #TheCHLI, THECHLI, as much as you can. And by all means, you'll have an opportunity as well to get to know the panelists and the moderator and the members of Congress who joined. So feel free to tag them as well in your comments. For our Congressional Briefing Series, as many of you know, these types of programs, whether in person or virtual, would not be possible without our sponsors. And you can see on the screen, we want to have a special thank you and shout out to our sponsors for this particular briefing and as well as the series. Pfizer, BP America, Chevron, Becker and Polyakov, Intuit, Molson Coors, and Ford Motor Company. A little bit about the format for today so you can follow along. So for our briefing today, we're going to start with remarks by Angela Remy with Pfizer. And after her comments, to kind of set the tone and get the conversation going, we will be joined by Congresswoman Melanie Stanford of New Mexico and Congressman Devin Nunes of California. After that, the Honorable Ileana Ros-Lehtinen, who's also one of our CHLI board members, and we call her the CHLI Madrina. She will be our moderator today. She will introduce the two special guest speakers on our topic. And then we'll get kind of a little bit before we close, Mrs. Ros-Lehtinen and also the gentleman here, they'll kind of take a little pause so that we can get some questions. They'll do some Q&A. I'll help them with that as well. So if you could please make sure to, as the program is going, if you can please go ahead and put down any questions in the Q&A chat. You'll notice on the bottom of your screen, you have a chat and then you have a Q&A. So if you can put your questions in the Q&A, it makes it a lot easier for us as we're following along. But in the chat, feel free to add questions or comments, shout outs to the panelists, anything that you may want to add to the conversation as well. So first of all, let me start by introducing Ms. Angela Remy. She's our first speaker today. She is the Vice President, Federal Government Relations for Pfizer. She's the former Executive Director for the Congressional Black Caucus Political Action Committee, known around town as the PAC. And she started her career with Prudential in New Jersey. So we're super excited and happy to have her here in the Washington, D.C. area. One of the things that I loved about introducing her is that she is very much a woman of the community. She is very involved in her Silver Spring, Maryland community. She is a member of the Silver Spring chapter of the Lynx Incorporated and the Montgomery County, Maryland chapter of the Jack and Jill. She also serves on the board of directors of the very prestigious Public Affairs Council. Ms. Remy, the floor is yours, dear.
Thank you, Marianne, for that introduction. You're my neighbor, so it was good to chat with you before we got started. And thank you to CHLI for the opportunity to participate in this briefing on a topic that is very important to Pfizer. It is also an honor to join former Congresswoman Ileana Ros-Lehtinen this afternoon for this briefing. We are really proud. We're really proud of our longstanding relationship with CHLI, and it's made possible through Pfizer's Multicultural Health Equity Collective, which focuses on helping to improve health equity across ethnic groups and other underrepresented communities. And through this effort, we've sponsored CHLI's briefing series for many years, and we focus on issues such as equitable health access to COVID-19, senior health, diversity in clinical trials, drug pricing, disaster preparedness and response, and many more. We always have great conversations with you. Our work with CHLI represents Pfizer's commitment to expanding access to Pfizer's medicines for all. And as you well know, our signature access initiative in the US is Pfizer Rx Pathways, which has been another longstanding focus of our work with CHLI. Pfizer Rx Pathways connects eligible patients to a range of Pfizer assistance programs that provide insurance support, copay help, and medicines for free or at a savings. And in the last 5 years, Pfizer has helped more than 1.2 million patients receive over 7.4 million Pfizer prescriptions for free or at a savings. And we're happy to report that enrollment into the program is easier than ever. It's available online for those with access via the internet or on a smartphone. And while we're maintaining paper applications for those without digital access. But today we're here to talk about intellectual property. And it's a very significant issue for Pfizer. In the case of access to medicines, that means we're talking about patents. Intellectual property has enabled the research and development of today's medicines, including and very significantly, the recent development of our COVID-19 vaccine and other vaccines. It's at the core of the pharmaceutical industry. It sustains the model. It's what we base our research and development on. So it's a really important topic to focus on. Very glad that you all are convening this discussion today, and thank you.
Thank you. I am going to now check to see if our next guest is here. I'm not sure if the Congresswoman has joined us yet. Congresswoman Melanie Stansbury. If not, we'll kind of move ahead, and just like we would if we were in person, as soon as the members of Congress join us, we'll take a little pause to make sure that we give them the floor, the virtual floor, for their remarks. And since we already have here the Honorable Ileana Ros-Lehtinen, I'm going to go ahead and skip on that section and introduce her because that's a longer bio.
No, don't do it. Don't do it. Spare the poor audience, Marianne. Just say I'm an FOM, a friend of Marianne's. And Angela, FOA as well.
So let me go ahead and introduce our moderator. As I mentioned, the Honorable Ileana Ros-Lehtinen is a native of Cuba. After a successful career in education, she served almost 3 decades as a member of Congress representing South Florida's very diverse communities. She was the first Hispanic woman to be elected to Congress, and she also served in the state of Florida's House of Representatives and Senate. She chaired the House Committee on Foreign Affairs and was the chairwoman of the subcommittee on the Middle East and North Africa. Her record over nearly 4 decades of public service includes fighting against the tyranny and oppression, particularly in her native homeland of Cuba, supporting free trade agreements with Colombia, Panama, South Korea, and the US-Israel strategic partnerships. As a teacher at heart, she continues to support students and young professionals. She is one of the founders of the Congressional Hispanic Leadership Institute. And as I mentioned earlier, among the CHLI familia, we all call her the CHLI Madrina, which means the CHLI godmother. So please join me in a little virtual applause for today's moderator, who still serves on our board of directors, and she chairs our We Belong Scholarship Campaign Committee. Ileana, the floor is yours, dear.
Well, thank you so much, Marianne, and congratulations to a wonderful set of panelists that we have. Wait till you hear about Mike and John, and thank you to all of the sponsors, as you said, Marianne. Thank you very much, and it's always a delight to see Angela. And Marianne, we have 2 esteemed guests who would join me on a conversation to answer the question that's right there on your screen. Innovation or access? Is it a singular choice for public health? That's what we're going to talk about. And as Marianne noted, we will have about 10 minutes of Q&A after our discussion. As she said, please enter your questions in the Q&A section on the Zoom webinar. Now I have the pleasure of introducing our panelists. Our 2 guests are just spectacular in their field. John Miller is the Senior Corporate Counsel, Global Intellectual Property, Policy and Advocacy at Pfizer. He has an MD from the University of Michigan Medical School and his JD from Rutgers Law School, a real underachiever, as is Mike. He's truly passionate about advancing educational and career opportunities for minority students and young professionals, and that explains his work on the board of SEEDS, which is a nonprofit organization that prepares motivated, high-achieving, low-income students for admission into competitive private schools and colleges all across the United States. John, muchas gracias, bienvenido, welcome. Michael Penn, oh my gosh, he's a principal counsel in intellectual property and litigation at Amgen, Inc. He works on a wide variety of intellectual property matters in support of Amgen's product pipeline and intellectual property policy and advocacy initiatives. For a couple of years, Michael was chief patent counsel for bioMérieux, a medical diagnostic company. Mike and his team worked on a variety of IP matters related to medical devices and diagnostics. And prior to Amgen, Michael was in-house counsel at MedImmune AstraZeneca. How do I say that? AstraZeneca? Zeneca. We'll figure it out. Zeneca. And was an associate at Stern, Kessler, Goldstein, and Fox, and was a patent examiner at the United States Patent and Trademark Office. Mike started his career as a scientist in the biotech industry, working on vaccines, gene therapies, and cancer immunotherapies. Wow. He holds a JD from George Washington University Law School and an MS from Johns Hopkins University and a BA from St. Mary's College of Maryland. Wow. So thank you, John and Mike. As you can tell, ladies and gentlemen, impressive pedigrees, but thank you for joining us at CHLI. So gentlemen, if we could, let's start by hearing from each of you. If you could give some 2-minute opening remarks to set the stage for this conversation. John, let me kick it off with you, sir.
Thank you, and thank you for that great introduction. Fantastic to be here with everyone, and really interested and excited for the conversation. And I think, you know, the purpose why we're here, like you mentioned, is to answer the question, right? Innovation or access. Is it a singular choice for public health? And I would say that I don't think a choice needs to be made between innovation or access. I would say that you know, IP rights, including patents and trade secret protection, provide the incentives that allow pharmaceutical companies to engage in high-risk activities, such as drug and vaccine development. And it's the legal certainty that robust intellectual property standards encourage the type of investments that are necessary to secure the production and reliable supply of medicines and vaccines. And in long term, the goal of patent law is to transfer innovation to the public sector. Makes the details of public inventions broadly available, and this promotes research by others and stimulates even more innovation, and also stimulates competition. And all of this activity leads to faster and faster launches of new drugs and access to new drugs and vaccines. And this innovation and these incentives lead to greater access for patients. So I would say it's not one or the other, but both. And I would also say that access or approaching access requires a holistic approach. There are other factors besides innovation and intellectual property that are involved with access, including facing the challenges of poverty, lack of health education, infrastructure, healthcare infrastructure, regulatory environments, and others on the list.
Thank you so much, John. You are certainly doing a fascinating and important work at Pfizer. Thank you for what you do, saving lives. And Mike, you're in the same line of work. Let's hear from you what your perspective is. Thank you.
Thank you, Atlanta. Thanks everybody else who's here today, and thanks CHLI for inviting me. This is a great discussion we're going to have. So, you know, thanks for your just incredible introduction. I've been in the biotech field for 30 years, and I've seen it go from the small startup company with these sci-fi like dreams of harnessing, you know, these unfathomable technologies to now what's considered an established field with a huge, robust portfolio of drugs. At Amgen, which is now a large biotech company, well, 40 years ago, we were a tiny startup of just a few people with a dream. And through the work of these incredible scientists, lots of dedication, Amgen led the first wave of these new biotech products. And importantly, these products were protected by patents. And that's what allowed Amgen to protect this enormous investment in time and money. It allowed us to protect these products. Without a strong patent system, without that predictable patent system, Amgen would not be in existence today. We now have dozens of life-saving products on the market, many more in various stages of development across therapeutic areas that are everywhere: cancer, inflammation, cardiovascular disease. None of these would be there if we didn't have a strong patent system. We understand no system is perfect. No patent system, no system of incentives is perfect. But the US patent system has served very well to, as John pointed out, continually incentivize development of new drugs, and importantly, the R&D foundations that enable this development. And as we look at this rapid, unprecedented success we've now witnessed with the COVID vaccine initiatives, that proves the success of this, that the foundations are there and the IP was there to enable this. So I would say, in closing, as we look forward to ways of possibly improving our existing system, as I said, no system is perfect. It's imperative we don't make changes to this very well thought out and carefully balanced system that yield the so-called unintended yet entirely predictable consequences. Innovation leads to access. And I think that's the point we need to understand, is they're not mutually exclusive. Thanks, and I really do look forward to this discussion.
Well, thanks so much, Mike, and thank you, John. And John, you had already answered the key question is on all of our screens: innovation or access? Is it a singular choice for public health? But before I continue with my next question, Mary Ann, I don't know if you're coming back to introduce Congresswoman Melanie Stansbury, and here you
Yes.
are. Go ahead.
Yes.
Thank you.
Fresh off of voting over there, Congresswoman, thank you for joining us. Greatly appreciate that. As you can see, we have the Honorable Ileana Ros-Layton with us moderating this panel discussion. I want to just do a short introduction of you. Born and raised in New Mexico, Congresswoman Stansbury leads with determination and compassion. She has represented New Mexico in the state legislature and now in Congress. She is a champion of efforts to address hunger, food and water insecurity, conservation and climate change, and economic development and recovery. Stansbury worked in committees across the state as a STEM educator, another teacher in the group here, a researcher on land and water issues, and was a staffer in the U.S. Senate Committee on Energy and Natural Resources. And she has also served in the White House Office of Management and Budget. Congresswoman, thank you so much. The floor is yours, dear.
Hello. Well, it's so wonderful to join you all. Thank you so much for accommodating our schedule today. I apologize that I'm a little delayed, but it's a busy week here in the Capitol. We're working hard to try to get 2 historic pieces of legislation across the finish line. And so our caucus meeting ran a little late and we're running back and forth between the floor to vote. So I'm actually inside the Capitol right now, and we'll have to leave right after this to go take another vote. But as was said, I'm Congresswoman Melanie Stansbury, and it's such an honor to be here with you today. And I'm honored to serve on this panel with our other distinguished panelists. And I want to start by acknowledging that it's been such a difficult year for so many people across our communities with COVID-19 and many of the other health and community and economic impacts that have come with that, and especially the pressure that it's put on our healthcare system and the inequities that still are so much a part of our healthcare system. As a member of Congress from New Mexico, which is a proud Hispanic majority state, It's an honor to talk about how these issues especially affect our Hispano, Chicano, Latino, Latinx communities, because they're so crucial to the well-being of our communities. And I'm especially excited to join you today and give a shout out to Marcela Mendoza for her exceptional work as our Congressional Hispanic Leadership Institute intern, who also worked on my campaign. And so we're so proud of Marcela, who just finished her fellowship with you all. And to my fellow panelists, thank you for your thoughts today. In New Mexico and across the nation, our healthcare system is beyond capacity. We just wrapped up a listening tour across my district in New Mexico, and the number one issue that was raised everywhere we went in my district was access to healthcare, from provider shortages to trying to find a way to get in to see somebody in a clinic, especially in our rural and tribal areas. Our healthcare system is strained beyond any way that it has ever been strained, especially with the pandemic. Countless families have lost members of their family, and our healthcare professionals and our frontline healthcare workers have been working around the clock, and many are leaving the workforce because of the strain that it is put on them. New Mexico is at the forefront of the vaccination effort, and I want to acknowledge that our governor has been such an incredible leader throughout the pandemic in helping to make sure that there's been good access to the vaccine, that we've been following public health protocols. Our tribes are at the forefront of getting people vaccinated, and we now have over 70% of our state is vaccinated. But we still have a long ways to go, and there are certainly even inequities in health access in terms of the pandemic. In fact, Hispano Latinx members of our community are underrepresented in vaccination in New Mexico, and that is something that we crucially need to address, and that is across the board in terms of people who self-identify as Hispanic, and particularly pronounced in community or undocumented communities. And we have a number of really amazing organizations in the state that are working collaboratively to try to help get more healthcare access and vaccination to everyone across our state. Our state has seen over 274,000 COVID-19 cases. We've lost over 5,000 New Mexicans, and of course, thousands of more have lost their jobs and been impacted, have come out of the workforce for other reasons associated with it. And these have strained our healthcare system, particularly in rural areas where there's already inequities in health access, and it's difficult to even get into a clinic or a hospital in a rural area in New Mexico. Our hospitals have enacted recently a crisis care standard because of that strain that's currently on our healthcare system with the rise in the Delta variant. So it's really such a crucial time in addressing health inequities. It's also very important that we expand access to vaccines, testing, healthcare services, and continue to help get out the word about the need for vaccination. I think that one of the biggest things that we can do to address health inequities in New Mexico is to ensure that we are addressing the structural challenges of why our healthcare system does not reach all people. I'm a huge advocate for universal healthcare. I believe strongly that the United States should join the rest of the world that has adopted a universal healthcare system. And as we're working towards that ultimate goal, that we fight for advancing and expanding healthcare access through some of the legislative vehicles that we're currently trying to get across the finish line. So this week, potentially in the next 48 hours, we'll be voting on 2 historic bills here in Congress, a massive infrastructure package and the Build Back Better Act, which includes a tremendous amount of investments in healthcare, from expanding Medicaid to states that don't currently have it, expanding Medicare, investments in our healthcare workforce, investments in our hospitals and rural clinics and tribal healthcare. And all of these things will be very important to addressing access for healthcare and healthcare equity. Everyone deserves access to healthcare, and that's why I'm here, why I'm fighting for a more just and equitable healthcare future for our communities. And as somebody who grew up in a working class family in Albuquerque that did not have healthcare and did not have health insurance, this is a very personal issue for me. I almost lost my mother because she did not have healthcare insurance before the Affordable Care Act. And luckily, she went to a low-income clinic in the South Valley of Albuquerque, where she was referred to have a life-saving MRI that she is still paying off to this day. And so for me, health access is an issue that is so deeply personal. And that's why we're fighting to make sure that we can address these issues at the national level, at the state level, and then improve those health delivery systems on the ground. So there's so many things that are important to discuss about how we do this. But I believe so deeply that healthcare is a human right and fundamental to the well-being of our communities. And I'm honored to be here with all of you today and to share my thoughts, and look forward to hearing from all of you about your thoughts and ideas about how we advance health equity across our communities. So thank you so much. And I'll turn it back to our moderator. Thank you.
Ileana, before the Congresswoman leaves us, because I know you need to get back to her, can we do a little Zoom photo? So I'm going to ask the speaker who was on just before, Angela, if she can come back in the view so that we can all be here. So when I count to 3, look in the camera, smile, and the team is going to take the screenshot. So 1, 2, 3. Okay, thank you very much. Thank you, Congresswoman, very much appreciate you joining us. This conversation, it definitely touches on the health aspects and equity and access, and we're kind of even peeling back a little bit even more to talk about innovation and access and intellectual property and all kinds of things that are really important as well for people to understand how those affect our daily lives. So thank you so much for being here. I'm going to pass it back to our moderator, the Honorable Ileana Ros-Lehtinen.
Well, thank you so much, Congresswoman. It was a delight to see and hear you. And I had the honor of serving with your governor when she was a member of the House. Michelle Lujan Grisham is an amazing, amazing woman. So felicidades to her. And thank you, Melanie. Marianne, thanks for the opportunity to continue this discussion with Mike and John. Thank you, Congresswoman. All the best to Michelle. And John, you had answered the question of the day, innovation or access. Is it a singular choice for public health? And I'm going to let Mike take a stab at that. And Mike answered the next question that I had, so I'll ask that one to John, which is the role of patents. We hear about patents or protection of intellectual property as being so important to promote innovation in the pharmaceutical industry. So if you could chime in on that, John, and then Mike gets the question of the day.
Sure, thank you. So the patent system is like we've mentioned, basically an incentive system in exchange for describing your invention to the world so that others can learn from it and build upon it. The patent owner gets to use it and enforce it for a limited period of time, where courts around the world recognize that inventor's exclusive use of the invention. And like we've been saying, that's the key incentive that drives the research that brings these medicines and vaccines to patients. And patents are a property right. They're a private right. They're a national right as well. So if there's no patent protection for a product in a specific country, then a generic is free to enter that market. And patent biopharmaceutical companies go to great expense to file patent applications and obtain patents in many countries around the world, often covering inventions that may or may not end up making it to market as an approved drug. And patents, do not prevent competitors from marketing their own products or similar products, provided that those products don't infringe the patents of the innovator's product. So the patents are very important in the field of medicines because they provide not only the incentive to do research, but also the opportunity for the inventors to use that invention exclusively for that limited period of time.
That makes a lot of sense. And Mike, weigh in on the is it a singular choice for public health, innovation, or access?
No, I think the point to take home is that innovation leads to access. And to back that up, I think we could all look to something like the WHO list of essential medicines. At one point, they were all patented. Now, depending on the year you look at it, it's anywhere from 95% off patent, 99% off patent. It varies year to year, but the point here is it was innovation protected by a robust, predictable, certain patent system that gave us all of those drugs, which now provided the world with access to all of those drugs.
Amen to that. And Mike, let me ask you about this 20 years. So people want to know, and I hear it all the time, why is it necessary to have patent protection period of 20 years for pharmaceuticals?
So we could actually, on the pharmaceutical side, argue that we're getting the short end of it. The patent term is 20 years from filing, but when you look at the timelines for drug development, right now, on average, your typical drug takes 10 to 15 years to develop. So you've eaten into 10 to 15 years of that 20-year patent term. If I'm making the next generation iPhone, it's not a 15-year timeline. So they might get 18, 19, in some cases 20 years of patent term for a phone. So don't we want to provide at least the same incentives for pharmaceuticals?
I think that makes a lot of sense. John, do you have, I know that you feel strongly about this issue as well. You want to share some words of wisdom with us?
Yes, I agree with Mike. The 10 to 15 year timeline of R&D and the cost involved in bringing drugs to market is very large. And there's also the risk of failures. I've seen numbers where, for every 5,000, programs that are started, only, 1 or 2 will make it to market. And there's the risk of late stage failures where, you start out in the laboratory working on a product and you progress it through studies in animals, and then you progress it to studies in healthy human patients, and eventually you get it to these large late stage clinical trials, and there's no guarantee, even after you've kind of climbed all of those hurdles, that the product will get past the finish line and make it to the market. And products have failed even at those late stages of development, and you lose the hundreds of millions of dollars that you've put into the investment. And even then, not every product that makes it to market actually recoups the money that was put into the research and development to make it. So it's a very risky business to make drugs and vaccines, and the incentives of the patent system are very important. And further to Mike's point about other industries is it's not just pharmaceutical patents that get 20 years of patent life. It's all inventions in other sectors as well. And they don't have the regulatory, often they don't have the regulatory timelines or the regulatory hurdles that we have in the pharmaceutical development that eats into the patent term. So I certainly agree with Mike's comments on this.
Well, thank you so much, both of you. And how about the argument that some people make that intellectual property could prevent access for developing nations to essential medicines and vaccines? Let's start with you, John, and then we'll go to Mike.
Yeah, so like we've been saying, intellectual property is what gives the incentive to introduce the new medicines. And Mike touched on the point earlier where I've seen numbers as well, higher than 90% of the medications that are prescribed are generic medications, and you don't get generic medications unless you have innovative medications. And there actually have been some studies done that showed that when you have weaker intellectual property systems in developing countries, that leads to delayed market entry. A lot of times pharmaceutical companies, when they have the certainty and the security of a robust intellectual property system, they feel more secure in bringing products to market faster. So innovation, which is stimulated by intellectual property, goes hand in hand with access.
Right, very much so. And Mike, let's hear from you about the argument that some folks make that, it's preventing access to developing nations.
No, I think John touched on every point. Again, you go to these essential medicines, they're generic at this point. And without that robust incentive system, you won't have that. And that's what we always have to keep in mind, is if you take that away, you're taking away access ultimately.
That's right. And continuing on this argument about access, how do patents promote access to new medications?
As we've been discussing, they protect these long-term investments. They're expensive. They're incredibly time-consuming. You know, the latest figures I've heard, $2.6 billion to launch a drug. John nailed it. So many of these drugs fail, and they fail.
And it's like he said, it's a risky business.
It's incredibly risky. So you need that robust, predictable, and certain system up front. That's what has given us our system here.
Now, can the argument be made that the patent term is too long? Should companies really get an additional time for researching new uses of an existing drug or maybe a procedure? What do the experts say about that?
So,
John?
So like we've touched on before, you know, pharmaceutical industry patents or pharmaceutical industry products rarely get to enjoy the full 20 years of patent term protection. And to the concept around kind of new innovations or small innovations leading to longer patent terms, that concept is a bit flawed because, you know, when you make a new invention, that invention has to stand on its own to get a new patent. And that new invention doesn't extend the patent on an older invention or an invention that's already for a drug that's marketed. So just because you get a patent on an improvement, and many of these improvements benefits patients. I mean, there's safety, there's efficacy, there's all kinds of work in the research and development space that's done on products after they've been on the market to improve them and to make next generation versions of products that benefit patients. So that work doesn't necessarily extend the patents on the older versions of drugs.
That's right. And now when I was in Congress, I had to review so much legislation that could impact a variety of communities. But tell us, you know, the name of this group, very proud, is the Congressional Hispanic Leadership Institute. How does intellectual property and related decisions impact the Hispanic community? Mike, we'll go with you and then with John.
Sure. I think our protections apply across the entire population. Ultimately, we want to continue to incentivize this system that has led to development and access of these drugs, whether new drugs or drugs in the future. And it impacts everybody. Everybody will benefit from this.
So some people say, oh, that's only for, you know, the folks who can afford certain medication, and many Hispanics that are in the lower socioeconomic figures, well, they won't get the benefits. What do you say to that, John? How do these patents help the Hispanic community as a whole?
Well, I'll say on two fronts, it helps the Hispanic community. On the first front, there's been studies that show that the countries or markets that have strong intellectual property systems in place, they attract more foreign direct investment in their own kind of domestic innovative ecosystems. So when multinational companies feel that their ideas and their innovations will be protected in the market, they're more likely to go in there and set up their own labs or research sites or manufacturing sites. And then that kind of bleeds into the local environment and the native kind of domestic industry grows. And then that's been shown to be true where there are strong intellectual property systems. But another way we can use, Pfizer's COVID vaccine as an example, where it was the IP system that was in place that allowed Pfizer to collaborate with BioNTech. Pfizer and BioNTech were already working on a flu vaccine using this new technology, and were quickly able to kind of repurpose that research and develop a COVID vaccine. And then further using that IP system that's in place, Pfizer was able to form an agreement with Europharma, who's a company in Brazil, that will help us manufacture the vaccine and supply Latin America. And if there weren't IP systems in place, there wouldn't be the confidence or the security to enter into these collaborative relationships and partnerships to provide, in this instance, the COVID vaccine development right there in the region.
Saving so many lives. And we're very thankful that you did that research and that you were able to roll it out into the market so quickly with all the safeguards in place. What do each of you can you say to our Hispanic community that you think, gosh, I wish that this community or that community or the community at large would know and understand about intellectual property as it pertains to our health and that of for our families? What are the one or two gems that you want to make sure that every community, but especially Hispanic community, understands how that intellectual property and that patent, that is good for your family, and that's good for the health of you as an individual, but definitely as part of this group. John, let's start with you.
Sure, I would go back, mainly to the points that we were making, where intellectual property stimulates the creation of breakthroughs, of scientific breakthroughs for diseases that where maybe there's an unmet need or diseases that haven't been tackled. And it's this intellectual property and this innovation that provides the new medications and the new markets, and medications that can go into these markets and get to patients. And I, the intellectual property system, like some of the questions that you've asked, kind of has this reputation of maybe blocking access and innovation, where in fact it actually has the opposite effect.
So I agree. I think that we need to all do a better job of making sure that all the communities understand that this is not blocking access. This is helping to get new drugs that are going to save your lives right into your hands, and it benefits everyone. Mike, I'll turn it to you.
I agree. And what's difficult to get through is it's long term. The benefit is long term. It's not immediate, and that's where it can seem frustrating at times. But we always have to keep in mind that if you don't have those long-term incentives and protections, the system disappears, and then access for everybody disappears.
And I think I so agree. And I think that the COVID, which we were talking about, really brought this issue of intellectual property and getting medicines to folks and saving lives, and how important it is to have these patents. I think that as horrible as this COVID pandemic, worldwide pandemic has been, at least it's gotten us to better understand the need for these medications, and the need to have scientists, like folks that you work with day in and day out. And Mike is a scientist himself, and John, a doctor, who understand this is a life-saving drug, and we need to make sure that your family has access to it. And this is the way that we give access to it. You need to let us do all of the research. Now, I noticed, Marianne, that we already have 2 questions queued up in our question and answer. I just want to remind our audience, and I know somebody in our audience is former Congressman Bill Flores of Texas. So Bill, thank you for joining us today. And please write your questions in that in part of the webinar there. And we are going to the Q&A box, and we will include who the question is for, and we're able to answer as many of these questions as possible. So Marianne, I'll bounce it over to you, young lady.
Okay, no, thank you. So the first question that has come up is, and I'm going to read it the way that it's in the Q&A. I don't remember now if you can see it over there too. It says, are there any vaccines that, because of the IP quote dilemma, that cannot be produced or come out? Is there anything that, it maybe is in the pipeline, or the things that, we talked about having access and being innovative? Is there something that you're aware of that maybe is just kind of stuck there, that it's not getting out, or it's not moving forward?
Not that I'm aware of. And I would also answer that I don't see this as an IP dilemma. And that if somebody sees it differently, that's an interesting discussion. But I think we would agree here that our IP system is what has allowed us to build this incredible foundation of R&D that let us produce not just one vaccine, but 3 or 4 vaccines in a year. That's unprecedented.
Yeah,
Yeah.
definitely.
Yeah, I think there's maybe a misconception out there that somehow the IP system blocks access to information and to treatments. And it's actually the IP system that discloses innovation and that teaches the world the inventions that are being made. If it wasn't for the IP system, scientists at one company might not know as much about what scientists at other companies are doing. Companies might turn to keeping their information more secure and not sharing it as much. And it's this shared information and this spirit of collaboration in the innovative ecosystem, which allows the breakthroughs to be made and allows new products to get to market.
So this kind of brings up to another question that I think Ileana and I had talked about before, just kind of in preparing for this discussion, and has come up. So there is still, and that's why we're having this discussion, right? Because there's a lot of information about what the intellectual property is, or like understanding the patents and different. So what is the best way for people to understand, or when they think of like, oh my God, something is blocking it, what is actually blocking it? So if it's not the intellectual property process of it, help us in like simple, non-medical, non-scientist terms, understand what it is that then they're actually seeing, or they're being confronted with, to kind of help us all understand better.
So it may be they're referring to this complexity in the industry. We could get rid of all intellectual property protection right now, and that wouldn't do a thing for COVID vaccine production or distribution, not a thing. And it's because these are incredibly complex products, incredibly. It takes years, if not a decade sometimes, to just build up that manufacturing know-how to be able to make these vaccines. We're not even talking the early discovery phases of actually inventing these vaccines. I'm just talking making them, right? Somebody teaches you how to make them. That's years off. So I don't see it as an IP dilemma.
Perfect, thank you. John, anything else to add to our non-scientist ears?
Yeah, I certainly would agree with Mike, and I touched on it a little bit early when I was talking about the holistic approach to access. What Mike is saying there is, there's the patents and there's patent terms, but there's the know-how involved with making these complex vaccines and some drugs that are complex as well. And then there's also, just healthcare delivery systems and infrastructures and sourcing the materials to make the vaccines, and the problems with getting things across borders and getting it to manufacturing sites. And there are many factors involved that's not related to intellectual property, that are related to other forms of government and regulations that are involved in access.
Yeah, as the Congresswoman Irena Ros-Lehtinen mentioned earlier, right? So there's a lot of things that came up during the pandemic that we as an average person didn't realize, right? Now we're like, how come I can't get the clothes that I want, that I ordered online? We're waiting for some ships that are stuck in the port in Long Beach. We've got different things that we can't do, or different things that we kind of got used to. And this whole process too, even with clinical trials and the process that went through for the vaccines, it's just a lot of new stuff that we just, overall just weren't involved in on a day-to-day basis. So it's a lot of new things that we're still going through. We're still, some of us, obviously, because we're doing this as a virtual program, we're not all able to get together in person. And so I'm going to ask one more question, and I see the Congressman has joined us. Congressman, if you don't mind, I'm going to ask one more question, and then Ileana really wants to introduce you. So, so I'm going to ask, because this question kind of piggybacks on the other one. So gentlemen, can you provide additional information about the R&D risks that pharmaceutical companies face today? What is the risk ratio to success ratio? I think maybe we touched on it earlier, but if you can, please again for the person who asked the question.
Yeah, we touched on it a bit earlier. I've seen numbers, for every 5 to 10,000, 1 or 2 get FDA, 5 or 10,000 compounds considered for research and development, 1 or 2 make it to market. The numbers I've seen were consistent with the numbers Mike mentioned, with 10 to 15 years of research and development and 2.6 billion per program to bring a single drug to market. But that the resources involved and the timeline horizons involved in research and development, and every program that you start, you believe it's going to make it to market, and we think these are all great ideas. So it's not like they're kind of special programs where you think these are the ones that can make it, and you're just doing the other programs just to fill out your pipeline. It's risky for all programs, and there's a very high failure rate.
I've seen 1 in 10 for late stage. So once you've progressed to the clinic, even where you've taken this idea and now you're going into people with it to test it, there's still just a dismal success rate. 9 out of 10 fail.
Yeah, and we actually saw that, right? We saw that with the vaccines, how, we were all kind of glued to the TV to see what the updates were and how the clinical trials were working and different things like that. So I think we all kind of collectively as nations have learned a lot about these processes. So I'm going to pause here and pass the floor back on to our CHLI board member, the Honorable Ileana Ros-Lehtinen, to introduce our next guest.
Well, thank you so much, Marianne, and thank you, Mike and John, for being excellent panelists. They've forgotten more about the intellectual property than we will ever learn. And I am so happy, so pleased as punch to be introducing Congressman Devin Nunes to our panelists, and as well as all of the audience of the Congressional Hispanic Leadership Institute. I've had the honor of serving in the committee, a very important committee, which is the Intelligence Committee in the U.S. House of Representatives, with my chairman, Devin Nunes. Chairman Nunes got to Congress in 2003. Is that right, Devin? You've been around the block a while. He has been chairman of the Intelligence Committee. He's been ranking member of the Intelligence Committee. He's ranking member on the Health Subcommittee on Ways and Means. Who knows if he's going to be the next chairman of Ways and Means? Soon we will know. But he's a great American representing the San Joaquin Valley, an area that is always in need of water. We all know that about Devin Nunes. He's a man of integrity, a man of honor, and I am so pleased as punch to call him my friend. And he knows a lot about this field because he deals with it in his subcommittee of Ways and Means day in and day out. So ladies and gentlemen, let's hear from Devin Nunes. Devin, anything you would like to say to CHLI about the issue of healthcare or patents or innovation? And we have 2 giants in the field here with us, Amgen and Pfizer. So take it away, Congressman Nunes.
Well, thank you, Ileana. It's great to see you again, as always. And ran into Lincoln down in Miami, I guess, a few months ago. So it's always good to see you guys. And I just saw Mario on the floor when we were voting. So, and of course, when you left Congress, we lost all the intelligence, if we ever had any, from the Intelligence Committee. So, but I just have some brief remarks here. A lot of people probably don't know, but the Republicans are putting together these what are called task forces, and there's a healthcare task force that I'm chairing, along with co-chairing with Brett Guthrie, who has the energy and commerce side of the ledger for healthcare. So we've been put together by the leadership to develop both a short-term plan that we could implement, something that Biden may sign into office, knowing that Biden would still be in the White House if we were to be lucky enough to win the majority back in 2 years. And then more of a long-term approach that we would work with whoever our nominee is for president in 2024 for some of the more long-term healthcare fundamental problems like Medicare going broke, for example. So I'm concerned about this, obviously the legislation that's moving through Congress right now. Seems like we don't really have our priorities lined up, especially relates to healthcare, because they're trying to add new programs to Medicare when Medicare is already going broke. So, and then as you well know, we've got the China problem. Ileana, you're well aware of that. China's knocking on Taiwan's door. We've got all of these issues out there. It's kind of the wrong time to be looking to start new programs and borrow more money when the Chinese are quickly, their economy continues to grow, their military continues to grow. And it seems like between them and Russia, there's a lot of problems out there on the horizon. One of the issues that I did want to bring up was this, the Biden administration supporting the TRIPS waiver that was proposed at the World Trade Organization. I'm sure many of you know about this, but this waiver would strip developers of COVID-19 vaccines and therapeutics of their intellectual property rights and force them to teach foreign competitors, including China, to make these types of products, which, I think at a time when China's posing all the problems we just discussed, why would you want to go and give them this intellectual property that we use to develop these vaccines? It's really a crazy idea. And I introduced legislation to at least make the point. It was the bill's called Protecting American Innovation Act that safeguards American innovation from the Biden administration's unilateral forced technology transfer by affirming Congress's authority over trade, including any potential waiver of obligation under the TRIPS agreement. So that was kind of a piece of legislation I like to highlight because I think it's relevant to in terms of the plan that we're trying to develop, both short and long term, and then dealing with this current monstrosity, and of course this TRIPS waiver concept that the Biden administration is moving. That's really what we've been focusing on. So, and we continue to have weekly meetings with our health task force. I think we call it the Healthy Futures Task Force, actually. And obviously, we're looking for any input that people may have. So it's great to see you all, and please
Thank
tell.
you,
I don't see Lincoln here, but please tell him.
He's here in spirit, wherever we are.
Awesome.
Lincoln, the Diaz Ballards are breathing down our necks, and that's a very good thing. Love Lincoln, love Mario, and I love Devin. So thank you, Marianne, for the privilege of introducing him.
Yes, and before Congressman, before you leave, we want to do a Zoom photo.
Okay.
So the team.
Right. What do I do?
The team is ready to do a screenshot. When I count to 1, 2, 3, smile and look in the camera.
All right.
And there's Angela. Oh, perfect. There's Angela. Okay. Everybody, 1, 2, 3. Okay.
Right.
And then just
thank you, Devin. Bless you. I love you, amigo.
The last
you,
note
guys.
for Congressman is Congressman, I'm from Stockton, California.
All right.
And my brother went to Fresno State. So, and I've been blessed here to, as you know, to be with CHLI for 10 years. And so it's always fun to see you and see our Californians fighting for water over there. What's the joke?
Marianne,
we
had
fight
a note
for water.
from Congressman Bill Flores saying,
Yes.
hey, Devin, hello
Hey.
to you. So he's watching you.
Thanks, Bill. Well, thanks for that kind note about the Valley too, but appreciate what you guys are doing.
Thank you, sir. Thank you
All
very
right.
much.
Okay.
Love you, Devin.
All right. Love you too.
So the Congressman brought up the TRIPS waiver. I don't know if that's something Mike, John, or even Angela, if any of you want to add it to what he mentioned about that, or if you have any additional information. If not, we can we've got a couple of more questions here.
Yeah, I think briefly, our view is it's the wrong direction to go. It's not just a matter of giving access to patents. It's, as the Congressman mentioned, they would like to force disclosure of trade secrets and processes. And once that's out, there's no bringing it back. You can give somebody access to your patent, right? And then it's done. Once you give them access to a proprietary process, there's no bringing that back. It's out in the open for good.
And I would add, similar to the conversation we were having earlier about kind of the multifactorial nature of access as a problem. You know, if you were to take the IP away, there's no kind of guarantee that all of a sudden everyone could just start making COVID vaccines and that they would be safe and that they would be effective. There's a steep learning curve to being able to do this, and there's a limited supply of the basic resources that are needed, the components that are needed to make the vaccine. So kind of posing IP as the barrier to, you know, vast distribution of the vaccine just isn't correct. And the voluntary licensing that has been happening, the kind of charitable donations of vaccine doses that's been happening, the commitment to provide kind of increased manufacturing capacity has been working well, and waiving IP would not benefit that process.
Okay. We've got two more questions. And let's see here. So one of them is, let's see here. Is there any specific legislation that is out there that would improve this current situation? The person started by saying, is this more a health care issue, or is it more an intellectual property issue? And then the specific question, is there any specific legislation that is out there that would improve any of the current situation? I don't know if either of you are more familiar with that, or if Angela, maybe you might be a little more familiar with any current legislation.
And I'm wondering if the question is about current legislation in general, or?
Yeah, it says, is the healthcare issue, so in particular to this topic, is there any specific legislation that is out there that would improve this, you know, this situation, this kind of whole conversation about the balance between the innovation and access? And obviously the Congressman mentioned one in particular. You know, we have a pretty good savvy group of people here that are interested in what other legislation is out there.
Yeah, there's a large legislative package that's being debated now that has multiple moving parts. And so, you know, I would just say from our standpoint, there are access elements that are key, but the devil's in the details of what's combined together, because we really need to be very careful about not unbalancing the healthcare ecosystem that has delivered this moment. And so while no system is perfect, I think that we could all say that our system delivered what we needed it to do in this COVID moment, and we need to be very careful about protecting this.
Okay. And then I don't see any other questions except one more. So if there's any other questions, please put them in the Q&A. The question is in reference to the innovation leading to access for public health. How can we ensure that we actively innovate the processes needed to provide the quality health services? So a little more on the health services side, but from your standpoint in terms of the innovation and the access, and both of them kind of leading to the healthcare access in particular, how can we ensure that we actively innovate those processes?
Yeah, I would say, I guess I would want a little more clarification on the question, you know, which processes they're interested in improving upon. But I would say, kind of to Angela's point, the innovative incentives and the innovative ecosystem that we have allowed us to step up and meet the moment with respect to the COVID vaccine and some of the therapeutics that are on the horizon as well.
Awesome, thank you. So you mentioned, oh, Angela, did you want to add anything else?
Oh, I mean, I might just add that
oh, we lost her. I think we just lost her. I'm going to just come back. And so John, you mentioned something that, you know, what we're kind of what's in the works now. So, you know, people are talking about like, what's the next phase? Is there a next phase? So like right now we're all kind of, I mean, some of us haven't gotten a booster, some are waiting for a booster, things like that. Just kind of, if you could share with us, how does that whole process actually work? So, you know, kind of getting past the vaccine a little bit. So how does the booster work? And maybe just kind of share a little bit with everybody how how that works, how that came to us in our communities, in our pharmacies. And then maybe we can get Angela back to finish her thought. So John or Mike, whoever wants to start.
Sure, I can comment on that. So I guess is your question how the booster was developed, or the concept of needing
Right, the
booster?
concept of it. So we've talked about, how there's concepts, there's different elements associated with different treatments or vaccines or different things like that. So just kind of to share with the audience as an example that, we have these we have these patents, we have this IP process. And so if you can share with us, how do we get to this booster so that people maybe have a little bit of a better understanding of how that works?
Okay, well, the boosters, or the kind of in the US, the boosters that are being discussed are the same shots that were given the vaccines for the first time around. So they're not actually different products or different vaccines where there was kind of additional research and development to develop a different vaccine. But the concept is the same, where, even after the emergency use authorization or after the full authorization of the vaccines was given, there's ongoing research. There's additional research that goes on throughout the life cycle of any medication. And in this particular instance, the vaccines, where, there was some data showing that the immunity or the immune response to the vaccine wanes over time. And that necessitated, the booster shots. So that's an example of where, like we've been saying, the incentives to continue to do this research and development leads to kind of further research after products are out there in the market being given to patients.
That goes back to some of the earlier discussion about incentivizing that continued research on existing products. Our scientists are incredible. You give them a challenge and that's all they think about. And, John touched on it. It doesn't stop once that product is launched in people. Somebody might complain, whether it's a vaccine issue, it's not giving good enough protection. That will keep our scientists up all night trying to figure out the next generation. And don't we want to continue to incentivize that? Of course we do.
Mm-hmm. Yeah. So what were some of the, what were some of the lessons? Somebody asked, what are some of the lessons learned in the industry, and particularly the pharmaceutical industry, in regarding IP and patent protections from that we just kind of all lived through or living through with the pandemic? Any lessons learned?
I think we saw the industry step up in a way I've never seen in my 30 years of being in the industry. It was a drop everything. What can we do to help everybody globally? And it's every company. People said, we'll figure out how to work together, but first let's figure out how to fight COVID. And it was, I think it's the reason why most of us are in this industry, because we truly love it and respect it.
Thank you, Mike. John, anything else to add to that?
No, I completely agree. When you said lessons learned, for me, it was just the scope and the amount of collaboration and everyone just working together and everyone trying to tackle this one program or this one problem with many different programs.
Well, good. I don't see any other questions. I'm gonna ask, I think she's still here, Ileana, or maybe she also accidentally exited out. So thank you again for taking the time. Learned a lot, as the Honorable Ileana Ross-Layton also mentioned earlier on. It's a lot of layers for information, and I'm glad that we were able to have some experts here today to talk about this, a topic that we all kind of live with, but we don't really always understand. And so it's important to kind of share that information. It was good that the Congressman also shared with us what's going on legislation wise and what he's working on. I also want to, before we close up, Want to thank again Angela Remy with Pfizer for being here with us today. Obviously, the Congresswoman Melanie Stansbury as well. And I also want to have a couple of other things. Just want to remind everyone who is listening, watching, if you could please pass on to college students that you know. We are still in the final couple of a few days here of our deadline for our CHLI Global Leaders Internship Program application. It's an opportunity for interns to live in Washington, D.C., intern with a member of Congress for about 2 months, and then intern in the government affairs, federal affairs office of a major company in Washington. It is a paid internship. So we're hoping that we have even more applications from college students. Please go onto our website to get more details about the application. And next month in December, our next virtual public policy briefing will be on sustainable energy. So if someone shared this information with you, please again, go back to the website, follow us so that you can learn when the details are for that one, the speakers who will be involved with that. And with that, thank you so much. Thank you again, Mike and John, for your expertise. Very much appreciated, learned a lot. Thank you all. Wish you all a good evening, and also make note that this is recorded so you can review it later. We will probably post this up in about a week or so on our YouTube page. And so we'll be sharing it there again. Thanks again, everyone, for joining us.
Thank you.